I appreciate the opportunity to discuss the impacts of the federal funding freeze and other key issues and how they would impact county governments. A preliminary assessment of the county's federal grants identified over $280 million in active federal awards, with $153 million yet to be encumbered. While some are unlikely to be affected by the executive orders referenced by the OMB, a broad federal funding freeze or pause could have significant consequences, as many of these grants operate on a reimbursement basis, meaning any disruption would have a delayed but substantial impact on the county's budget and cash flow, which impacts our ability to respond nimbly to serve constituents, especially in times of crises. Coming from Ventura County, we know crises well, unfortunately, with significant impacts by wildfires almost on a yearly basis. This year, our total budget is just over $3 billion, with $1.4 billion in the general fund. Absorbing the cost of affected grants would place considerable strain on our operating budget should we be put in a position to reimburse work that has already been completed through existing agreements. Counties cannot backfill for the lost dollars that would be created from a potential federal freeze or cut of these dollars. Tapping into the county general funds is not an option to backfill health and human services that have now been put into question. While counties have significant differences, this is something we absolutely have in common. Mr. Flora mentioned climate change initiatives, so I'm going to touch on that really briefly. Regarding grants specifically referenced in executive orders, in our county alone, we've identified about $12 million for charging and fueling infrastructure grants as particularly vulnerable to funding delays and have already been paused. Continued or prolonged pause would result in cancellation or delay of critical service initiatives, including our EV charging centers, our off-grid EV charging solutions paired with solar battery storage, deployment of over 150 fast and level 2 chargers across our county, our e-bike integration programs to reduce vehicle miles traveled, and our workforce development programs to train workers on the installation, maintenance, and operation of the expanding EV charging network. Again, these initiatives are essential to aligning with the state's transition to electric vehicles and the electrification of our county's fleet. Regarding health and human services, we are closely monitoring potential impacts across the county. The county has assets specifically designed to support populations referenced in the executive orders and have been proud to provide culturally relevant services to vulnerable populations. Understanding the idea that in population health, the total health of a community is measured by those with the least amount of resources, and only by serving those do we keep our community, our whole community, healthy. Our Human Service Agency has identified about $150 million in federal funds that would be subject to no longer being funded because of their specific purpose in serving vulnerable populations. To note, our Human Services Agency budget is $340 million. As Ventura County is an agricultural county, it is important to ensure we do serve these vulnerable populations, as this also supports the economic vitality of a critical industry in our county as well. Because 1 in 3 county residents rely on services from our Human Services Agency, including 240,000 Medi-Cal enrollees, we know that the potential impact of funding freezes or cuts could be absolutely devastating. Additionally, proposed changes to service certification and the recertification process, such as new work requirements, would significantly increase workload demands on our county workforce, while resources are being significantly decreased. The California Welfare Directors Association's assessment of at-risk funding streams that flow through the state and could ultimately affect our ability to provide services is eye-opening. Programs such as supporting safe and stable families grants, child abuse prevention grants, SNAP food stamp benefits, and temporary assistance for needy families, also known as TANF. Regarding public health funding, in 2024-25, CDPH's total budget was approximately $5.35 billion. This is comprised of approximately $960 million in the general fund, $2.2 billion in federal funds, and $2 billion in special funds and reimbursements. Several large urban jurisdictions receive funding directly from the CDC, so that won't be included in these numbers. Some of the programs that could be impacted are the family health programs, so $1.3 billion, infectious disease programs, $274 million, public health emergency preparedness, $162 million, and healthy communities programs, $17 million. The uncertainty that is caused by the unknown is profound, and as a result, we as county CEOs across the state have embarked on a deep dive analysis of all the federal funding we receive as a county and what those gaps would look like. More, what programs would be cut, the number of staff that would be terminated, what services would no longer be provided, and ways that the safety net would not serve those that need these critical services most, and the ripple effects that this would cause. Again, I repeat that the impact would be devastating to our health and human services agencies, including public health and behavioral health, and would prohibit the ability to serve our most vulnerable communities, and backfilling what for some counties range from 10% or more of our general fund is not fiscally responsible or feasible, given the other commitments those dollars have been allocated for. These services would be lost and could cause irreversible damage to our residents and therefore our communities. Thank you for the opportunity to speak, and I'm able to answer questions at the appropriate time.
Thank you very much, Dr. Johnson.